Welcome back to Washington Journal. We're joined now by Representative Greg Landsman. He's a Democrat of Ohio and sits on the Energy and Commerce Committee. Welcome to the program.
Thanks for having me.
Start with healthcare.
Sure.
A lot's happening, and at the same time, nothing's happening on healthcare. So can you update us on what exactly is going on, what's being voted on, and what's actually going to happen with healthcare ACA subsidies?
So just by way of context, there's 22 million people who are relying on us to act, because they need the Affordable Care Act subsidies to pay for healthcare. And there is a desire by a lot of us to get this on the floor for a vote. The Speaker decides what happens, whether or not it comes to the floor, and the Speaker does not want to extend the Affordable Care Act subsidies.
And that's because he personally doesn't want to, or do you think that that's the president's position?
I think it's more his position and the position of most congressional Republicans. I don't think the president cares one way or the other. I think if the president were to, get engaged, and the problem at the moment is that he's not really engaged in any of this. He's focused on other things, which is frustrating for most Americans, certainly members of Congress who want him to be focused on this issue, affordability in general, but the healthcare affordability in particular. There is a discharge petition, so you can go around the Speaker and you can force a vote. You just need 218 signatures on a petition which sits in the well, and you just go up and sign it as a member of Congress.
How many does it have right now?
214 for a 3-year extension, so we just need 4 more.
Do you think you're going to get those 4?
Maybe today, because the Speaker refused to give Republican moderates a vote. They asked for a vote on the ACA subsidies, and they were rejected last night. There's another discharge petition, which is bipartisan already. I've signed on to both of them, and that would be a 2-year extension with some changes in the second year. For me, the 3-year extension is the cleanest, it's the easiest, but whatever it takes, because there's 22 million Americans that are relying on this. 32,000 in my district. Some districts have more than 100,000 people who need the ACA subsidies to pay for their health care. And the only thing that matters is that we get this done, that we extend the health care subsidies. And my worry is that the folks in charge, the Speaker, the Majority Leader, and the President, by being completely checked out from this whole process, they don't care. They're not going to get it done. And so people are going to lose their health care.
As you know, the argument is that the ACA or Obamacare was flawed to begin with, and that it was never affordable and we shouldn't need subsidies. So why hasn't this been fixed since over the last 15 years, since it has, according to this argument, been so flawed?
Yeah, I mean, because healthcare is flawed. The system of healthcare in this country is incredibly complicated. It is everywhere, but certainly in the United States. Ultimately, I believe there needs to be a public option, and Obama had pushed for that at one point in the whole process. If you have a public option, the private insurance companies really do have to compete, and they have to answer for jacking up prices in a way they don't right now. And so you create a public option, you let people buy into Medicare if they want. It's an incredibly efficient healthcare delivery system. And then those folks who don't get their health care either through the public option or Medicare, Medicaid, or through their employer, they still need something. And if they can buy into Medicare, that would be great. And in the absence of that, you have this marketplace where people can go on. It's less expensive than it would have been had it not been pursued. But yeah, healthcare has gotten expensive, and they need some subsidies. Now, there are additional reforms in addition to the public option. You can require transparency for all of the healthcare companies and hospitals. That's one of the things that we're pushing for. But ultimately, it costs money, and Americans, if they get it through their employer, they're paying more. Their employers pay more. And one of the reasons why so many employers are no longer providing health care and moving people to the marketplace, to the Affordable Care Act, is because it's gotten so expensive, because we've never really fixed the underlying issue, which is it's a few private sector companies that don't really have to answer to their customers. They can kind of they can kind of jack up prices whenever they want.
So you're saying that it's the insurance companies that are gouging Americans, and that's why we pay so much more than they do, say, in Europe or Australia or other places.
Yeah, it's a big reason. I mean, the insurance companies make, billions and billions of dollars. I'm not a big believer that healthcare should be a for-profit enterprise. It should be run by an entity that, like Medicare, whether it's public or not, is not taking huge sums of profit
So
out of
can't
the
you guys in
system.
Congress regulate that?
Yeah, of course. Yeah, you
And
just
why
have to have.
haven't you?
There just hasn't been the votes for a public option. They tried to do a public option when they passed the Affordable Care Act, and they got very close. But the way I understand it is it got struck out. It's just a line in federal law that says that Medicare is for anyone age 65 and above. If you just get rid of that line, people could buy into Medicare.
Greg Landsman is in the studio with us. He's a Democrat of Ohio. If you'd like to talk to him, ask him a question, you can start calling in now. Republicans are on 202-748-8001, Democrats 202-748-8000, and Independents 202-748-8002. Switching now to Ukraine. On Monday, Ukrainian President Zelensky said that Kyiv had been offered the equivalent of NATO's Article 5 protections. That would be binding by law, and that would need the Congress to approve that. Now, Article 5, as you know, is an attack on one, is an attack on all, and everybody's required to come to their defense. Where do you think this would go in Congress if this would actually go through?
I think it passes. I think people understand, not everybody, but most understand that if Ukraine doesn't have these protections, that Putin will continue to pursue with military force, territory in Ukraine, and he'll continue to press on into Eastern Europe. And then we're back where we were in the 1930s, where you had, in that case, Hitler and Germany pursuing Europe. And it ended up being incredibly costly, incredibly deadly, and he should have been stopped immediately in Austria and even Poland. And so our opportunity now is to stop Putin and push him back. And my hope is that there would be strong bipartisan support for that.
How do you get Putin to agree to that?
I mean, look, at the end of the day, you have to stand up to this guy. And you have to say, you got to get out of here. Otherwise, you're going to deal with the consequences economically. I mean, additional sanctions. And and continuing to support Ukraine as they push him back. But you can't give in to somebody like Putin. You can't appease this guy. And appeasement has been a failed strategy in the past.
Now, yesterday, Defense Secretary Pete Hegseth had said that the Pentagon will not release the video of that double strike attack on September 2nd, but he would show it to the members of the Armed Services Committee in the House and the Senate. Is that enough for you?
I mean, at the end of the day, if he's going to do that, we'll see what happens. I'm not sure he will. But no, I think the American people...
You're not sure he will release it to the committees?
No, I doubt it. I don't know. I mean, maybe he does to some, but the question is, why hasn't he done it to date? I mean, this has been weeks now, and they have been incredibly cagey with the video, but just the information here. And it raises serious questions about what we're doing at all in the Caribbean. I mean, you just think about it. You got Ukraine and Putin and Eastern Europe, and that is a huge problem. And they need to be focused on that. The administration does. You have the Middle East. They took their eye off the ball. They don't have the same kind of focus on resolving that conflict that they did a couple of weeks or months ago. And then you have the situation with China and the Taiwan Straits. All of these situations are hugely important and require constant attention by the President of the United States and the people around him. And what are they doing? They're like, blowing up boats in the Caribbean. It's It's hugely problematic. It's
Well,
not
they're saying they're stopping drugs from coming into the United States and killing Americans.
one boat strike at a time. I mean, that's the war on drugs and stopping the incoming of fentanyl and other drugs is very complicated. You have to focus on all the ports of entry. They're just blowing up ships in the Caribbean. It's not an effective strategy, and it's pulling resources away from other efforts to deal with drug trafficking, human trafficking, and they're moving all these military assets to focus entirely on this because I think at the heart of it is just the president's beef with Maduro. It's Trump's agenda. It's not an America First agenda. It's what Trump wants, and Trump wants to go to war with this guy, even though that's not in our national, security interest. Yes, the drug war is, so he should focus on that. But he picks these fights with folks, and my sense is there's a lot of money in play. And that's typically what motivates this guy is making tons of money for himself.
On the oil in Venezuela?
I suspect it's more complicated than that. Oil is more for the country, and that has been something that has gotten America in trouble, or presidents in the past. Trump is more of a money guy for himself and his family.
Do you think we're going to go to war in Venezuela?
I think if Congress doesn't step up, that's the president's intention. Yes.